This man has had gynecomastia ever since he was an adolescent. And one thing he told me, and it's something I hear from a lot of men, is that when it's cold or their nipple tightens a little bit, their gynecomastia looks a lot better. And that makes sense, because as that just tightens up and shrinks down, it really decreases the amount of puffiness that's in the areola. For a lot of men, when the areola is warm and soft, it sort of gets thin and pliable, and that little bit of gynecomastia behind it pushes it forward. If you turn just a little bit this way, at this angle is the angle where you really see most what this man has. And it's just this little puffiness here in the areola, that when that areola tightens up, it gets a lot better. One of the things I found is men who say it stays the same all the time usually have more fat, but not always. And usually men who describe getting better as the areola tightens, they almost invariably have a little nubbin of firmer tissue that won't come out with liposuction but needs excision. And in his case, if you pinched him right here, you would feel a little bit of a firm, almost walnut kind of feel on each side. By doing a little bit of liposuction to improve the overall contour and removing that little firm area inside, we'll be able to get him a nice smooth contour. One thing I've told him though, when men tend to have larger areolas and a good size piece of tissue behind it, when we remove that gynecomastia, sometimes the areola doesn't fall down and doesn't flatten out as smoothly. Remember, his areola is smooth now because it's being pushed out because of the tissue behind it. And when we remove that tissue, that areola doesn't always tighten up perfectly. It's like removing some stuffing from a sofa. It depends on the kind of overlying fabric, whether it's going to tighten up nicely or whether it's not going to tighten up. In his case, it'll do fine, but it won't be quite as smooth and tight as it is right now.